It is the cardiac conduction system which allows the heart to act like a functional syncytium, complements of how it drives the myocardium. When you talk about the conduction system of the heart, you're talking about specialized areas of cardiac muscle tissue. They are self-exciting and autorhythmic cells. Their job is to initiate and distribute those electrical impulses through the myocardium, which cause the heart to beat. There are coordinated events that occur during the cardiac cycle, which allow the heart to be an unbelievably effective pump. You need to know the components of the cardiac conduction system in order. The pacemaker of the heart is the SA or sinoatrial node. There will be internodal pathways which will bring that signal along the atria, including Bachmann's bundle. That information will travel to the AV node, the atrioventricular node, and then along the atrioventricular bundle, also known as the bundle of His. That will split into the right and left bundle branches, which are located within the interventricular septum. And then the branches will divide out into the Purkinje fibers, the conduction myofibers, which will wrap up and around within the ventricular walls. They are associated with the papillary muscles of the ventricles. And the papillary muscles of the ventricles are going to be connected to the chorda tendineae, which in turn are attached to the AV valves. This shows you a simplified diagram of the cardiac conduction system. SA node to the internodal tracts, to the AV node, to the bundle of His, to the right and left bundle branches, to the Purkinje fibers. So, as a reminder, the bundle branches are going to run in the interventricular septum, and the Purkinje fibers will be in the myocardial walls of the ventricles. Just another image. It shows you what's going on for reinforcement. Excuse me. Now, you need to know about ECGs, EKGs. EKGs is often used. It is just the German for ECG. They use K instead of C for cardiogram. What is it? It gives you a recording of the electrical changes that are going to happen within the myocardium during what's known as the cardiac cycle. Why do we care? Because it'll help you determine if you have a normal conduction pathway, if the heart is enlarged, or if various regions are damaged. Rules that are useful to remember are depolarization is going to happen before or precede contraction, and repolarization is going to precede relaxation. So here we have it. This is what you need to know. Take a look at the diagram or the image down on the right, and then let's look at the P wave, which is that small upward wave. It tells you that contraction is about to occur. I'm not going to ask you what happened, what time, 1.1 second after P wave begins, the atria contract. No, I want you to know that this means that the atria are going to contract. And then we have the QRS complex, which is this giant spike right here. It's going to begin as this little downward deflection, and then you have this giant wave there. Just after that occurs, the ventricles will contract. As the ventricles contract, the atria will relax, but because the mass, the muscular mass of the atria is so small relative to the massive amount of myocardium in the ventricles, that is basically overridden. So atrial contraction, ventricular contraction, atrial relaxation. This T wave means ventricular depolarization, which means basically the ventricles are going to relax. That shape means it's going to happen relatively slowly. Watch this, required viewing. And it's really cool, actually, because it shows and describes heart activity, what's occurring relative to the EKG. So more of the same. Atrial contraction, ventricular contraction, atrial relaxation, ventricular relaxation. If you know that, you will be fine for this class. Now, what happens with abnormal ECGs or EKGs? An enlarged P means you may have mitral stenosis because you have enlarged atria. Enlarged Q, rut-row, you might be having a myocardial infarct or heart attack. Enlarged R means you might have ventricular hypertrophy. Arrhythmias. I have one. So cardiac arrhythmias basically are just telling you that there is an abnormal pattern of cardiac electrical activity. And it's not uncommon because about 5% of so-called healthy people have a few not normal, I don't want to say abnormal, we'll use not normal heartbeats every day. It is not a problem unless you have a problem with pumping blood efficiently. Premature atrial contractions occur relatively frequently in healthy people. They're sort of a surprise atrial contraction. Can be increased in terms of incidence if you are stressed, if you're drinking a lot of caffeine, if you're taking certain drugs that are going to increase permeability of these sinoatrial pacemakers. And normal ventricular contraction will follow that atrial beat. Ventricular tachycardia, VTAC, 4 or more PVCs without an intervening normal beat. If you have multiple PVCs and VTAC, you may have serious cardiac problems. This is not good. Ventricular VFib or ventricular fibrillation. This is responsible for cardiac arrest. It is very rapidly fatal because your ventricles are quivering, but they are not pumping. So you have a problem. Let's continue on. What the heck with cardiac cycle, the heart sounds, and cardiac output. Whoops, I missed that. Cardiac cycle. You need to know this. It is all of the events that are associated with a single heartbeat. All of the electrical events, all of the mechanical events. So it's going to be a series of pressure and volume changes that occur in the heart during a single heartbeat. 2 terms you need to know, systole and diastole. Systole is the contractile phase of the cardiac cycle. There will be atrial systole and there will be ventricular systole. Most people, when they hear systole and diastole, they mean the ventricular activity, but remember that the atria have to contract and relax also. When you have ventricular systole, blood is going to be moved out of the ventricles and the AV valves will close. When you have diastole, you're talking about relaxation phase of the cardiac cycle. There is atrial diastole. The right atrium is going to take blood in from the superior vena cava, the inferior vena cava, and the coronary sinus. The left atrium receives blood from the pulmonary veins, and the AV valves are closed. Now, again, cardiac cycle means that you have systole and diastole of both atria and systole and diastole of both ventricles. Remember all of the activities that are associated with one heartbeat are included in the cardiac cycle. The atria and the ventricles will alternately contract and relax. So let's think about what's happening. When the atria are contracting, they are pushing blood into the ventricles, so the ventricles are relaxing. the AV valves are open. When the atria are relaxing, the ventricles are contracting. When you talk about the flow of blood, blood will flow from areas of high pressure to areas of low pressure. So as a chamber contracts, the pressure increases. As a chamber relaxes, the pressure decreases. This is basic physics, and I'm sure you understand these concepts. Again, cardiac cycle is a complete round of systole and diastole for both sets of chambers. It is a period between the start of one heartbeat and the start of the next. Heart rate is the number of beats per minute. The two atria will contract first, filling the ventricles. Both ventricles then have to contract in order to pump blood into either the pulmonary or the systemic circuit. Atria will contract and relax simultaneously. Ventricles will contract and relax simultaneously. When the atria are contracting, the ventricles are relaxing. When the atria are relaxing, the ventricles are contracting. We already have this, just an image saying the exact same thing. And we've already talked about this. Atria contract together first, push blood into the ventricles. The ventricles are relaxed in diastole and filling. Ventricles will then contract together, which means blood is going to be moved into the pulmonary or systemic circuits. And while that is happening, the atria are in diastole, relaxed and filling.